Okay, so today we're going to show you what the instruments look like for Amalgam 1 for our skills. The first thing you're going to give the dentist is a mirror. That's what mouth mirrors look like. It's just like that. And they're going to keep it in their hand the whole time. The second instrument is the Explorer. You'll notice it's very sharp and pointy, and it's a little bit curved there. They're going to use that to make sure that they are working on the right tooth. Then we're going to give topical anesthetic. That is like a jelly that's going to numb the gum tissue. And we're going to put that on a cotton tip applicator. That is before we give the anesthetic. We're going to use an aspirating syringe. And depending on where we work will depend on which one you pass the dentist. If it has a blue or a red needle on the very end, that is for a maxillary injection. If we use a yellow, that's yellow lower longer, that's how I like to remember it, that is going to be for a mandibular injection. And you're going to wait 10 minutes, maybe 15, and wait for the patient to get numb. Once they're numb, we're going to use the high-speed handpiece, which is a drill, and it has water coming out of it, so you're going to use the HVE as the assistant the entire time. That's going to put the initial hole in the tooth. Then we're going to use the slow-speed handpiece, and that's going to have the round burr on it, and that's going to remove decay. You will again be using the high-speed hand, or the HVE, excuse me. Then we're going to use the spoon excavator. Notice it looks like a tiny spoon. It's double-ended. One side is bigger than the other. That is going to be used to remove any excess decay. They can actually scoop it out. And then, just like the aspirating syringe, depending on what tooth number we work will depend on the next instrument. This one is a chisel. It's going to help make undercuts. You would give the chisel if you were working on a maxillary tooth. If we were working on a mandibular tooth, we would use what's called the hatchet. Again, it's making undercuts. This one just happens to be bent different. So chisel is straight. Now, we don't want any sensitivity when we're doing a filling. The patient doesn't want sensitivity, so we're going to need to use varnish, liner, or a base. The varnish smells like nail polish, and you would actually dunk that little blue microbrush you just saw right into that liquid. The other option is if it was a deeper filling, we would mix a liner. That's just a drop of each one, and you would still put it on that little blue microbrush and give it to the dentist. Now it's time to mix the amalgam. We're going to mix it in the amalgamator, put it in the amalgam well, and then we're going to put it in this instrument that we're showing you right now, the amalgam carrier. You're going to pack that amalgam into it. Pass that to the dentist, and then the dentist will need the plugger. This is the amalgam plugger. It looks like a hammer. One end is bigger than the other. You always are going to start with the smaller end. Okay? Now, the first carving instrument is going to be called a discoid cleoid. This end looks like a spoon, if you saw that, kind of like the spoon excavator. The other end looks like a leaf. It looks like a leaf. You can see it just right there. That's going to be the first carving instrument. It's going to flake off the amalgam. When this is being used, the assistant will have the HVE to get all of that excess amalgam that's being taken off. Now we want to put some anatomy back into the tooth, so we're going to use the anatomical burnisher. See how there's a point? This is also double-sided, and they both look the same. Then we're going to use the ball burnisher. That's going to be used to smooth off where the amalgam is coming up on the cusps of the tooth. So that's the ball burnisher. One end is bigger than the other. It just looks like a true ball on the end. Now we want to make sure the bite is not too high, so we're going to use the articulating paper holder with the articulating paper, and you're going to pass that, depending on which side we're working on, you're going to pass it so that they're not going to bite down on that metal. And what that does is it's going to leave a little blue mark on any amalgam that is up higher than the rest of the tooth. If it is high, they're going to go back to that discoid cleoid. Remember that leaf and spoon. If we've tested it with the articulating paper holder and we've had to adjust it, we're going to go back to the articulating paper holder. You want to make sure that you did get it all off. Now, depending on the dentist, most will want a wet cotton roll. You'll just get that wet with your air water syringe and give that to the dentist. They're just going to use that to wipe off the tooth they worked on so they can check their work. And then the last step is to use the HVE and the air water syringe to do a final rinse for the patient. And then the directions are, we're going to say to stay away from that tooth. That amalgam is not set up all the way. So you're going to stay away from it, away from that side with anything hard for about 24 hours.